I generally do not recommend that family members conceal the patient's condition and treatment purposes. You may take time to find a suitable occasion to break the news, but do not hide for an extended period or indefinitely, especially when the patient is already on treatment. The patient has a right to be informed, especially when planning for treatment, as this goes against medical ethics and guidelines and is not in line with legal principles. After all, the patient is required to provide signature or verbal consent for the treatment purposes. Putting oneself in the patient's shoes, one would also don't want their children to make decisions and implement treatment plans without their knowledge. While the intention may be good in most cases, the outcome tends to be tragic eventually. This happens repeatedly among many families like yours. Concealing the patient's condition may lead to a breakdown of trust, and the patient may feel deprived of control of their own life and affecting collaboration and treatment outcomes. Additionally, doctors typically seek the patient's consent when deciding on treatment plans, following the principles of shared decision-making. However, in certain special circumstances, such as when a patient explicitly expresses a wish not to know their condition, or when knowing it could impose a significant psychological or physiological burden, doctors may balance the pros and cons while respecting patient's preference and not family's preference. My advice as an oncologist to family members: transparency and communications are vital cornerstone in building doctors and patients' relationships. Open and honest communication channels should be established between doctors and patients to ensure optimal medical outcomes and patient satisfaction. This is Dr. Teo signing off.